It's really evident in most cases that youth listen to youth. I think it's all mental, where it's like, oh, they're like me. They go to the same school as me and they're telling me this. Oh, it's because it's true.
The LA Trust started in 1991. LA Unified received a grant to address teen pregnancy. And they were to establish 3 community clinics on school campuses, and this was like revolutionary. The district pursued that and needed to have a partner to bring the funds in, so they established the LA Trust.
Access to healthcare can be very difficult to get. For many working class families, it means missing a paycheck to take someone to the doctor.
My family is really big. We have like 6 kids in total. When we have a wellness center on campus, and since the students are part of LAUSD, we just make an appointment and just go.
Over the course of 8 years, we painstakingly built, with community partner input, this tool called the Data Exchange, which actually merges a student health record with their academic record in a HIPAA and FERPA protected way. Last year was the first year that we were able to really pull together a statistical analysis, and we were able to demonstrate that one wellness center visit results in 5 to 7 days of added attendance to a child's ability to stay in school. That is something that is beautiful for a child's success, but can also be monetized. So the way that we've constructed this over the course of the last 12 years, when we started this, was that there would be an adult ally. Students then enter into an agreement to become a student advisory board member. They are taught by our staff, and then they communicate those learnings, I'll say, to their peers, their families, etc.
We would have weekly meetings, and we would, as a group, kind of come up with like, oh, this week we will talk about self-care or awareness on like STDs and so many other like health-related topics.
I relate to students, which is why I love working with them, but it's also like I'm not a student anymore. Opening up to them where they're actually experiencing it every day. They're at lunch with everybody. They can feel the vibe, the energy of the campus, so they know what's needed more than I would.
You know, I feel like people should know about sexual health. I feel like people should know about their mental health. I feel like they should acknowledge when they need help with their mental health. And being a part of SAB helps that.
I actually had a student text me asking me that their friend thought they were pregnant, and she's like, what do I do? What do I say? So them having that confidence in us, that relationship, to actually call us, text us when they have peers reaching out to them, it's amazing.
You know, over the period of time with COVID, obviously the disassociation from school, from community, from friends, all of that lack of social connectedness has really impacted our kids in such a dire way. And so for us, this is like a really urgent time. We have to get it straight.
The COVID Youth Task Force is a program that the LA Trust started in collaboration with UCLA to educate youth on COVID, vaccines, virology, and really help them answer those questions that they have during these uncertain times.
My favorite part about doing the COVID Youth Task Force was that it gave me access to a lot of professionals in the field. They were very open-minded, and they were like encourage us to participate.
COVID, school, being a student, living in a neighborhood that's underlooked is hard, and it takes a toll on your mental health.
So when we hear that students in the program, are going out in their community and answering questions, we feel really, really honored, because that means we're doing the right work.
In this period, suddenly schools are looked to as part of the solution, which has been the mantra from the beginning. So I feel like now is our time to really look at what these systems can offer, support these systems, and help them really grow so that our children across the United States and beyond are really cared for.